Do you have overbite? Time for some PFOing so you know where you're going. Alright parents, and you kids out there who are watching this video because you've heard of that word, overbite. Yes, I'm an orthodontist talking to you about overbite. It's a big deal and we need to address a few things so you don't miss out. First, most people when they talk about overbite, they are referring to what orthodontists actually call overjet. Everybody's top teeth should be in front of their bottom teeth. Alright? Alright? Everybody should have a little bit of overjet. We don't want you to be where your top teeth are hitting right on top of your bottom teeth. We don't like that. That's actually not good. So if you think your bite's supposed to be like this, you want your top teeth to be at least partially in front of your bottom teeth. Some people, though, have variation of that called an underbite. An underbite is where your bottom jaw is forward in front of your top teeth. And then there's the other extreme, which is where folks have your top teeth look like they're way out in front of your bottom teeth like that. This is called excessive overjet. And it's critical that if you have this kind of overjet, or even if it's just a little bit, even just a little bit, you need to see an orthodontist.
Like right now.
We had a patient come in recently. She's a teenager with just excessive overjet. That means that her top teeth were considerably in front of her bottom teeth. Okay, so this is the x-ray that orthodontists might use to check on your growth status if you're getting close to your peak growth or puberty. And then this also demonstrates what happens with your bones, all right? And folks that have lower jaw bones that are really far back compared to their top bone, look at that. You got your top bone right here, and then your bottom bone is way back here. And so you end up with this big overjet. And this is something that as an orthodontist, I would have loved to try and address with growth modification. That means taking this lower jaw and trying to push it forward, hold it forward, but we might move it forward and we try to hold it in that position for several months to a year and hope that we get the growth of the jaw into this position so that we can avoid things like surgery or taking out teeth down the road. I was just bummed for her because for all you individuals, parents and kids out there, know this, is that there is an ideal time to try and treat an excessive overjet with what orthodontists call growth modification, right? That's a great phrase, growth modification. Sounds almost as good as Pam, like Kramer. And the reason why I was sad for this girl is because she has missed out on the opportunity to try and get predictable growth modification. So what is growth modification? Well, for your information, okay, let's start at the beginning. When we are growing, our bodies are growing in our mom's tummies. Lots of things are growing. And when we come out, if you look at a baby, next time you look at a baby, see how far their lower jaw is set back. It almost looks like they have no chin. It's because the lower jaw is the least mature facial bone. When babies are born, they really have no lower, they have a lower jaw, but it's just not very developed. And then as we get older, sometimes you'll see the young kids that looks like their lower jaw is back. They have a little bit of excessive overjet, and to a degree that's normal because we're just so young. But then as we get older, we go through puberty. We all know what that is. Some of us may not. That's when we see a lot of the facial features really grow. We develop our adult looking face. Well, what orthodontists have learned is that we can't really grow mandibles. That's what the lower jaw is called. You can't really grow the lower jaw, meaning you can't do anything to it to grow it larger than whatever you already have programmed into your genetic code, all right? So however big your jaw is gonna be, that's how big it's going to get. But what orthodontists have learned is that we can modify that growth, all right? So let's say you're growing like this and your lower jaw is back and you've got that excessive overjet, all right? Get into the orthodontist soon, and what they're gonna do is consider some appliance or means of posturing this lower jaw forward like this. So it goes from here to here, and then you hold it there. You hold it there for several months, maybe even close to a year, and during that time, what's happening is that your bones, your lower jaw, is trying to grow into that position. That's kind of a way to say it, right? We're modifying the growth. We're trying to control the direction and get it so that that new position with the minimized overjet is a stable position, and you grow into it. That is what growth modification is. I can't tell you how important this is because if you miss miss your peak growth spurt to do this growth modification, then your only options at that point are to consider something like surgery, where they break the bones and move it forward and then screw it back up. Now, that is a very viable option, and it does amazing things for folks that have that lower jaw that is so far back. But if you could avoid that by going through growth modification, how sweet would that be? The other option is that you take out 2 teeth on the top. So for example, if you had the excessive overjet, right? Like this. And what you could do is you could take out a tooth on this side and a tooth on this side, and then pretend like, well, now you've got space back there, so you can take these front teeth right through here and try to pull them back and get rid of that. So the only thing about that is that sometimes it hurts your profile. It makes your upper lip sink in. There's plenty of people that have had that done where they take out the top teeth. It just depends on your particular situation. So it could also be a viable option. But again, if you can avoid that by going through growth modification, right? That's what I'm talking about. Now, how do we time it? Well, that's why you need to go see your orthodontist. On average, according to the textbooks, right? Girls could start hitting their peak growth spurt around 10 and a half, 11. Some girls are before that, some girls are after that. Boys, sometime between 12 and a half and 13 is when they hit that peak growth spurt. So you don't necessarily want to wait until that time. You probably should be seen by the orthodontist before that so that you can plan appropriately to try to capture that growth. Again, if you can reduce that, what you call overbite, what we call overjet, we're no different, through a growth modification process, I think that is a huge win. So don't wait on this, all right? Well, what are some tools that we use for growth modification? In our office here in Anna and McKinney, Texas, our favorite is the Herbst. There are other offices that use things like the Mara. Headgear was something that people used, or orthodontists used. You parents out there, you lucky folks, had to go to school with headgear. There's other devices too. Any device that you can take in and out of your mouth, like rubber bands, or even sometimes headgear. It can be really hard to get the same results as something that's glued in place. So parents, even though some of those glued in devices might look a little scary, I'm telling you, for predictable results, you might want to consider something that's glued in. Now, is growth modification a guarantee? No, but it's fairly predictable. Sometimes the discrepancy is just so big that you may need to do a combination of growth modification and taking out teeth. Or your provider might just say that, hey, the best way to get this fixed is by surgery. Hopefully that's not the case for you. For the majority of people, there's so much that can be done with growth modification, and so you need to talk to your orthodontist about it. Hey, if you like this video about growth modification and it got you so excited to go see the orthodontist, give us a like. Leave a comment below if you had a chance to go through one of those processes, growth modification, specifically related to helping fix overjet, and consider subscribing to the channel so that I can open your eyes to the wonderful world of straight teeth growth modification so that we can have beautiful bites. That's all I've got. Just a little PFO so you know where you're going. Packard out.